Assalamu alaikum and welcome to this week's Journal Club, where I'll be talking about a paper published in the Journal of Endodontics by Tan and others in 2020, titled Long-Term Pulpal and Restorative Outcomes of Pulpotomy in Mature Permanent Teeth. The objective of the study was to examine the immediate and long-term status of the pulp and restoration after pulpotomy in mature permanent teeth with caries pulp exposures, as well as to identify potential predictors of early and late failures. This was a prospective cohort study, and the sample size was 52 patients and a total of 61 teeth. The patients were aged from 21 to 75 years, and most teeth were asymptomatic or had only mild symptoms. So for the procedure, the pulpotomy was performed using an aseptic technique with biodentin, and partial pulpotomy was the preferred method, which was performed in 55 of the 61 cases. The teeth were followed up for up to 5 years, and the status of the pulp, signs and symptoms, and restorative and periodontal health were assessed through clinical and radiographic examinations. So they defined failure as 4 definitions. The first one was unfavorable outcome, which was defined as irreversible pulpitis or pulp necrosis with or without apical periodontitis, and failure, which was a strict criterion defined as any intervention needed, including root canal treatment, tooth extraction, or revision of the coronal restoration due to recurrent caries or defective margins, even if the pulp was normal, and early failure, which was an unfavorable outcome that occurred within 6 months of the procedure, and finally, late failure, which was an unfavorable outcome that occurred after 6 months. So they found that the overall pulp survival rate was 90%, and only 6 teeth developed irreversible pulpitis or pulpal necrosis while the restoration was intact. There were only 5 early failures, which was 8.2%, which required root canal treatment due to symptomatic irreversible pulpitis. And they found that preoperative pain was a potential predictor for early failure, because 4 of the 5 early failures had some level of preoperative pain. Late failures occurred, there was 11 cases, and it occurred between 2 to 4 years after the procedure. And there were several causes, which included pulpal necrosis, recurrent caries, and restoration failures. And the predictors of late failures was the type of the definitive restoration. This was the significant factor for late failure. And it was important to note that glass ionomer cement restorations were associated with a greater risk of failure. The study also highlighted the importance of the restoration. It emphasized that while pulp complications are rare, the success of pulpotomy in the long term is highly dependent on a secure and durable coronal restoration, and failures often stemmed from restorative issues such as recurrent caries, even when the pulp was healthy and responsive. So in conclusion, pulpotomy is a predictable and viable treatment for mature teeth with deep caries and vital pulp exposures, regardless of the patient's age, and the procedure is a feasible alternative to pulpectomy and root canal treatment. And there were 2 main clinical recommendations. The first one was pulpal complications are most likely to occur within the first 6 weeks, so it is advisable to delay the definitive restoration until after this period. And the second one was the decision regarding the definitive restoration. It should be made before the pulpotomy procedure due to the substantial loss of tooth structure often associated with deep caries, and careful case selection and placement of a high-quality coronal restoration is crucial for long-term success. Thank you very much.